Hello and welcome. I'm Steve Clemons, editor-at-large of The Hill. Thanks for joining us for COVID-19 Vaccine, Trust in Communication, a look at the rollout of the COVID-19 vaccine and the role fact-based communication can play in countering disinformation and building trust. Before we begin, I'd like to thank our sponsor, Granicus, for supporting today's event. Among the many obstacles in supplying, distributing, and administering COVID-19 vaccines, the ability to communicate reliably is proving to be an added challenge. A quick look at social media shows how conspiracy theories and falsehoods can easily spread. From fighting misinformation to reaching disadvantaged communities and marginalized communities and broadband deserts, governments at all levels have to find ways to engage, educate, and get the vaccine message out to all Americans. So what does effective communication look like in these times, and how can we reach all communities with accurate information, especially those who are skeptical of the vaccine? To answer these questions and more, we have an exceptional lineup of speakers, including leading public officials, health professionals, and communications experts. Before we get underway, a few housekeeping notes. You can tweet us at The Hill Events using the hashtag #TheHillVaccine. We're broadcasting live and we'll be taking your questions throughout the program. And as with any live stream, and I laugh at this, they say, if anything goes bad, just push refresh and everything will be great. I hope that works for you. Never does for me. My first guest is the White House Senior Advisor for COVID Response, Andy Slavitt, a former acting administrator of the Centers for Medicare and Medicaid Services. Andy, thank you so much for joining us today. You have a tough job right now because, there's this line of high demand for the vaccine that is being rolled out. Now we have the the Pfizer vaccine, the Moderna vaccine, and now the Johnson & Johnson coming online. But we read stories where, something like the Capitol Police, 40% of the D.C. Capitol Police haven't gotten vaccinated because there's hesitancy out there. So my question to you is, when does that line of hyper demand for the vaccine and then the line of skepticism cross, where we need to spend more time really drawing people in to be vaccinated who are skeptical versus the heavy demand for it right now?
Well, look, thanks for having me on. It's good to be with everybody today. Look, part of honest and direct and open communication is to just talk straight, give really simple answers. So we have a shortage. We have a shortage of vaccines today, and Americans are experiencing a shortage. We haven't lived with shortages in this country for a long, long time. That shortage, as you say, won't last forever. It'll be a matter of months. But in that matter of months, we know that creates anxiety for people. And it's important that we tell people like it is, and we try to give people as good an expectation as possible. The answer to your question is it will change based upon, it differs, I should say, based upon communities you live in. In some communities, we're already there. In some communities, we're already we're in past the mode of people who want to take it in the first wave. And I don't think about it as people who want to take the vaccine versus people who don't. I think about people who want to take it in the first wave, people who are fence sitters in the first wave, but will get off the fence for a second wave once they see what's happened in the first wave. Then, a wave of people that have questions that need to get answered individually or collectively, and then I think at the end of it, there's a small group of people, can't tell you how large, but it's not as large as people would estimate, that don't want to take it. And those are, those people tend to have some features in common and some concerns in common. And we're learning what those are, and we have to have those conversations with people. But over the next couple of months, we will get through waves of people who have been clamoring for the vaccine, and we will get to a stage where we have to start reaching that next group. I think you'll see us launch efforts at that conversation. Even before we get to that point. So, relatively soon.
Andy, what is your methodology, your dashboard for reaching communities that have been tough to reach in the past? This is an area where there's, not only logistics distance, but skepticism. And, the show we're doing today is probably not reaching those communities. We'd like to, but it's out there trying to reach folks that have not been easy to reach. What are the methodologies you're thinking about?
Yeah, it's a great question, because in healthcare, if you do nothing, people who have the most advantage, the most privilege, the most confidence in dealing with the healthcare system will tend to have much higher access. What we've learned is there are some things that work. You can't just move vaccines into communities that are underrepresented that you want to serve, because if you do and don't do anything else, we learned is that people, if you put a bunch of vaccines into Oakland, left to its own devices, people from San Francisco are going to cross the bridge and take those vaccines. So what you have to do is you have to make sure you're reserving appointments for people who live in the communities, and you have to do special outreach. We launched a pilot with the insurance companies launched this week that's called Vaccine Community Connector, where they're making outbound calls to people who are in marginalized communities, arranging transportation, arranging rides, answering questions about the vaccine, arranging follow-up appointments, and scheduling appointments. So you've got to basically go at those barriers. And if those barriers are transportation, if those barriers are location, if those barriers are trust and who's there to have the conversation, you've got to just take them down one by one. But you have to prioritize it because there's a communities largely this is an occupational disease. This is a disease that affects people who interact with the public all the time. That's why it's hitting certain communities harder. And we have to make sure we're taking care of those communities actively.
Andy, when you were running the Centers for Medicare and thinking about, the infrastructure of what the health picture of the nation was going to look like, how it gets paid for, what the social contract is between insurers and citizens and PBMs and that whole health ecosystem, are we now looking at a kind of new permanent overlay where we are going to have a vaccination infrastructure year after year after year and does that create opportunities for thinking about the social contract in health that we really haven't discussed nationally yet?
Well, that's a hugely insightful question. And you're right. All the things we've talked about for years but never do, prevention, right? Prevention becomes, how much more important does prevention become when you've got people that are at high risk of getting infected? Making sure that people have annual vaccinations. It's not a whole lot different from making sure you throw a blood pressure cuff on people and make sure that they have those. So the one thing I think is that's one big lesson from this. Another big lesson from this is what have Americans not had to worry about during this entire crisis? The one thing they haven't had to worry about is a copayment on their vaccine. Or am I in my deductible so I can't afford the vaccine? All of those barriers that we set up that prevent people from getting good health care, they were originally set up because we were worried about people getting too much expensive care. What I think we've learned over time is, yes, there's a category of things, maybe, an MRI, the things that get overused, but there's a huge category of things that have been underused. And vaccinations would certainly fall into that category. Primary care visits would fall in that category. So there's a lesson here about simplifying this system, having people not have to worry about, can I afford it when they want to get good health care, that I hope we apply to the rest of the healthcare system.
Are you finding that the use of trusted ambassadors, trusted faces, voices in various Native American community, Hispanic community, Black community is actually moving the needle when it comes to participation rates? Do we have any kind of evidence at all that approach is working? We hear from communities that's what might motivate them, but I'm just interested in whether anybody stepped back and said, okay, in Los Angeles, we did achieve something, in Arizona, in Montana, by using this. And I'm just wondering whether or not in your sandbox, you've been able to see any real movement of participation rates, because we do know from the head of the CDC today that we are still seeing lesser vaccination rates in Black and brown communities than the white community.
Well, I don't think we have actual data on what's happened yet and what's worked. I think we have a lot of data on what people think works, and a lot of people who've studied this question, and what they'll tell you is local doctors and pharmacists are very important in the equation. Local doctors and pharmacists who look like the people they're communicating with are important because they understand their reality. Getting straight answers to simple questions is a must. People don't want to be persuaded or convinced. Your employer and the people you know in your world are very important because if you're sitting on the fence, that's really useful for you to know. Celebrities, they may attract your attention. They may get you to pay attention, but they might not necessarily convince you to get vaccinated, except for Dolly Parton, of course, who I think should be persuading everybody with all the stuff she's doing. So I think that there's also a certain subset of folks who they really don't want to feel the top-down pressure. Top-down pressure won't help them. So if it's coming from the government, or it's coming from the pharmaceutical industry, or it's coming from a celebrity, even someone they relate to, that may cause them to trust it even less. What they really want is they want to know that they've got the freedom to choose, that they've got that they're not getting pressured, they can get their questions answered, and so there becomes important that whoever the messenger is using the right language and responding to people's concerns.
Let me just get two last quick questions in. One of the other things that I've been interested, we've talked a lot on this show and The Hill, about the connectivity challenge right now, that we've, kind of really moved from an analog world to a digital world because of COVID. Everything's who we love is online, how we work is online, our health care is online with telehealth. And I guess the question is, if you don't have that internet access, you're at a disadvantage compared to others on a lot of fronts. But a lot of people have phones. Are you finding strategies to get to people wherever they are digitally, whether it's on a smartphone or some phone system, as well as high-speed broadband?
I just need to clarify for the record that who I love is IRL in real life. It's not someone. It's not a digital relationship.
Yeah.
So everyone knows my wife. She's a real person. She's 3-dimensional, God, we were dating even before.
I was thinking more like
along,
grandkids and grandparents. I just stepped on that one.
I know. But look, gotta keep it real. Look, I think there is online and there's online. So for certain populations, younger populations, the more digital, the better. The simpler the experience, the better. For some lower income racial and ethnic minority populations, SMS and texting is actually quite effective. So I think it really depends. And for some people, as you say, they don't have broadband. They may not even have cell phones. And so, you got to be at their church. You got to be in their real life. You've got to be at the places that they go. They may not leave the house except to go to church on Sunday. And so having a mobile van in the parking lot afterwards, and having their church leader talking about, or their faith leader, whatever faith, talking about vaccination, and then being there is important. Radio, as we know, with a lot of communities, with the Latinx community, with the Black community, with rural white communities, radio is actually an important link. So those are all really important. And the final thing I'll say about the digital piece is that the other side of the digital piece is misinformation and disinformation. Because getting someone the wrong rumor, or a false answer or an unreliable answer to a legitimate question they have because they've gotten that answer on Facebook, that's a problem.
Right.
So the digital platforms, social media platforms, have a job to do here. And I really hope they don't fall behind, as happened with elections and everything else, but that they stay way ahead of making sure that we are not allowing misinformation and disinformation to hurt our ability to get people the answers they need to get them vaccinated.
Let me just ask you finally, one of the things I love the profile you have is you've been in the private sector, you've worked in government, you communicate. And if I were, interviewing you last September or October, and we were honest, there was kind of a law of the jungle out there. So it's not just about trust between the patient or the person getting vaccinated, and whoever the provider of that vaccine is. It's all the other components. It's the companies, the states that were competing against each other, for PPE and for materials out there. I did global interviews where, we were talking about vaccine nationalism, and I'm just wondering whether or not, in not a rah-rah way, has that law of the jungle subsided? Is trust and confidence coming back throughout the system among the science community, the corporate community, the patient community, and internationally?
Well, look, I think trust is slowly earned. I'm buoyed by the fact that people of both parties across the country say they have confidence in the approach that President Biden has taken, but I don't take it for granted either. I think people expect us to be working our butts off. I think people expect us to be honest with them, both for the good and the bad. I think people expect them to expect us to try to underpromise and overdeliver as much as possible, and when we mess up, to say so. I think people hope that we will let the scientists speak for themselves. Not that they will be the only voice, but that their voice will be unencumbered and they'll be able to do their jobs. All career civil servants across the government can be unleashed. I think they expect us to involve the private sector and make sure that this is all of country response. And so when we do our briefings Monday, Wednesday, and Friday, there's an element of consistency, short, straight answers, honesty, and that I hope shines through, because I think trust is, again, very slowly earned.
Right. And
as you rightly point out, we begin in a trust deficit, and we have a highly divided country. Getting people, and I give great credit to people like Hugh Hewitt and others who have engaged in public dialogue with me and with others about to get out ahead and say, let's not let what happened with masks happen with vaccines. Let's not let vaccines become a symbol of your political identity. You want to have a different political view than your neighbor? Fine. Nothing, you should. That's our country. But there are things that don't have to be part of that identity. And our health, our ability to get back to life, all those things should hopefully be there. So we're trying to do that. Ultimately, we are not the judge of whether we'll do it successfully. The country will tell us based on whether they see us doing what we say we're going to try to do.
Well, I really appreciate the straight talk. I used to interview Senator John McCain a lot, and he used to have the Straight Talk Express. I sort of feel like you're the straight talk guy right now. So Andy Slavitt, right now senior advisor for the White House COVID response team, former acting administrator for the Centers for Medicare and Medicaid Services. When he gets done with this gig and we've solved and, brought saved America, essentially, with COVID vaccinations, et cetera, he's going to go back. He's got a great podcast, The Bubble, and I look forward to you getting back to that. So, Andy, thanks so much for joining us today.
Thank you. Best to everybody.